This is part 4 of things that aren't talked about enough when it comes to endometriosis. Today we're talking about the value of holistic management strategies for endo. Now, admittedly, this isn't a management strategy that is appropriate for everybody, but even if you apply holistic management strategies and don't necessarily see this reflected in your symptoms, you better believe that there are some positive changes happening beneath the surface. So let's consider some of the things that we know about endometriosis and the positive overlap with holistic management strategies. The first thing I want to briefly talk about is LPSs. So LPS, or that is short for lipopolysaccharides, this is the outer layer of gram-negative bacteria that we find in the microbiomes throughout the body. If the LPSs are contained within, for example, the gut, and they don't have the ability to cross through the gut lumen into the blood, then that isn't as problematic as the alternative. When LPSs are able to cross through the gut lumen because somebody has leaky gut or increased gut permeability, these LPSs are associated with more severe forms of endometriosis and endometriosis proliferation. But endometriosis aside, it's also associated with metabolic dysfunction, increased risk for autoimmune disease development, and body-wide inflammation. So how do you prevent these LPSs from getting through the gut into the blood? You want to maintain that gut integrity with things like colorful plant diversity. You want to develop a effective stress management strategy because we know that cortisol increases the gaps between the cells that line the gut. You want to avoid alcohol. You want to avoid eating an excess of processed sugar or refined carbohydrates. And you also want to be mindful of the type of movement you're doing because high intensity movement can increase cortisol, which would then also increase the potential for leaky gut. The next thing is we know that endo is in part hormonally driven. We know it's a condition of estrogen excess, or it's at least estrogen dependent. We often also see progesterone resistance among endometriosis patients. Things like eating enough, meal spacing, blood sugar balance, satisfying nutrient gaps, getting in adequate amounts of omega-3s, getting adequate amounts of B6, again, applying an effective stress management strategy, doing an appropriate form and intensity of movement. All of these things can help support optimal progesterone levels. And then things like eating lots of cruciferous vegetables, again, getting adequate amounts of omega-3s in the diet, getting a lot of flavonoids and colorful plant foods in the diet. All of these things, getting enough manganese, all of these things help upregulate estrogen elimination down the quote-unquote best or optimal pathway to reduce estrogen excess symptoms as much as possible. The next thing is high inflammation. There are a lot of things that are within our control when it comes to inflammation. The two things that we have the most control over are your diet, so you can eat an anti-inflammatory diet, and exposure to environmental toxins. So here you have control over the quality of the water that you drink. You can filter the air that you breathe, at least within your home, and you can control the types of products that you're putting on your body, or the types of cleaning products that you're using. The next thing is dioxin exposure. So dioxins are fat-loving chemicals that tend to accumulate in high-fat foods. So here you can control dioxin exposure simply through controlling your diet. And the last thing I want to talk about in this video is immune system deficiency. There's a lot I can say on this. I'll just provide a brief explanation here. The gut is your largest immune organ, so everything that applied to the first point on lipopolysaccharides applies here. There are several vitamins and minerals like retinol, vitamin D, amino acids, omega-3s, selenium, iodine, zinc that are essential for optimal immune function. And you can get all of these things through a all-encompassing, well-rounded anti-inflammatory diet. No medical management option or hormone therapy supports all of these hallmarks. In fact, some of them may actually make some of these worse. Like this video if you want more content on improving your endometriosis symptoms with holistic strategies.